Welcome to Navigating Nursing School with your nursing tutor. On today's episode, I'm going to be helping those of you who have ADHD get some tips for being more successful and thriving in nursing school. I get this question a lot. I say, I have ADHD. How can I get through nursing school? It's harder. Give me tips. Does your silver bullet study system work for ADHD? Things like that. So today I'm going to give you some of my best tips and suggestions for when you have ADHD and you're going through nursing school. If you don't know me already, my name is Nicole, and I am the professional nursing tutor with over 15 years experience, and I am the founder of yournursingtutor.com, where I provide group tutoring membership, one-on-one tutoring, pre-nursing student workshops, and more, basically, so that you can get through nursing school confidently and calmly. I specialize in helping adult learners, but I will help anybody who is going to nursing school, because guess what? We're all in this together. Future nurse, okay? And we want to make our chosen profession to be as supportive and positive as possible. So that's what we're all about here. I say we, like I'm a family business. So today I'm going to give you a few good tips for what to do in nursing school if you have ADHD, so attention deficit and hyperactivity disorder. I'll say first that before I jump in, that a lot of stuff I have also learned from, I learn from other experts too, right? Like I curate from other people who are more experienced or work with a lot. I mean, I have worked with a lot of ADHD students in nursing school, obviously over the years, but ADHD is not the area that I have personally specialized in. I've specialized in helping nursing students learn to think like a nurse, which is why I often will go to other experts to learn and get suggestions from them. We won't call it stealing suggestions, but that's, it's teaching, learning, right? So one of my friends that I have learned a lot from is Jacqueline Senfeld. And she has a book called Untapped Brilliance, and she also works with adults with ADHD, especially business owners, but I think she branches out to more than just business owners with ADHD, and she does I think she has an ADHD membership, and she also does one-on-one coaching. So if you're interested in that, you can check that out. I'll try to make sure to post a link to her website in the show notes if you want. And other than that, I did an interview with her a few years back too, and that's also included in my group tutoring membership. So if you want to see her entire interview, because the cool thing about Jacqueline is that she is also a nurse. So she actually did her nurse training in England, and then now she moved to Canada, and has specialized in this ADHD, helping people with ADHD to thrive, really, and live their, feel like they're reaching their full potential. So she knows what it's like to go through nursing school. And so when I interviewed her a few years ago for my members, a special video for my members, she gave like a whole hour on tips for ADHD in nursing school for nursing students. So if you want to see that entire video, all you have to do is join my group tutoring membership. You can do that by going to yournursingtutor.com/membership. It's a monthly membership. You can cancel anytime, but it is available there in the bonus resources. But I'm just going to give you a few of my tips today. So the first tip that I have for if you have ADHD is that if you qualify for learning accommodations, take them, use them. Okay, you are going to probably have to advocate for yourself in a lot of cases in order to use them. Some schools are really good about it, but others either give you a hard time just because learning accommodations can, let's be honest, they can feel inconvenient to the instructors and the school. But guess what? They are legally required to provide them to you. And if anybody tries to make you feel bad about it, that says more about them than it does about you. And you should not care about their opinion in that case, okay? Because the truth of the matter is that the American education system is old school, and it's been set up in a way that accommodates the most common type of brain, let's just say, the most common way of learning. Now, the most common way of learning is not the right way of learning. It's not the normal way of learning. It is simply a very common way of learning. Therefore, it does not mean that you, with your ADHD brain, that it doesn't mean that there's anything wrong with that at all. Okay. It just means that you're probably going to learn a little bit differently than somebody who has the, quote unquote common. And then the question here too is ADHD brains even that uncommon, right? Not as much as we used to think, right? But anyway, and so as such, do not feel bad at all for using the learning accommodations. Use them. Use whatever you need when you need it. It can be a bit of a process if you, especially if you don't have a diagnosis yet. And this goes for any kind of learning issues, by the way. If you have any sort of diagnosed anxiety disorders or learning challenges, anything like that, use your your testing accommodations. Use your testing accommodations. So what can this look like? Sometimes it can look like you get extended time to take your test. Sometimes it looks like you are going to, you can take your test by yourself off, maybe in the computer lab or something like that, versus having to take it in the classroom with all of your other students and getting distracted by, people tapping their pencils or just fiddling with their hair or whatever it is. So whatever it is, take them. Now, the process, like I said, can take some time because if you don't already have a diagnosis, you will need a diagnosis from a doctor. So you need like a doctor's note. You'll have to turn it into the appropriate department at your school. So most schools have a special department that's used to handle all of the testing accommodations. And then, of course, they'll also help you communicate that with the nursing department. So, and never, ever let somebody make you feel bad about using them. And if they feel like they don't want you to do it, or if they say, oh, well, if you can't do this, how are you going to handle being a nurse? You'll say, very easily, thank you. Okay? Because when you become a nurse, first of all, you can find any kind of nursing role that suits you. And secondly, you will find your own ways to make that nursing role work for you and work for your brain type and the way that you think. So take your testing accommodations. Second tip is when you are studying, make sure you're using active study techniques, okay? You want to have active, not passive learning strategies. And if you go back a few episodes, I'm not sure exactly how many, but somewhere within the last 4 to 8 episodes, I would say 4 to 8 episodes, I talked about passive versus active learning strategies. Now, you definitely, if you have ADHD, you definitely want to be using those active learning strategies, because if you're just using passive learning strategies, your brain's going to be bouncing all over, right? You're not going to be able to focus and because it's not going to be engaging. You're not going to be able to engage in it. And this is fine because honestly, this is how everybody should study anyway. So it's going to be better for you in the long run, but it's going to be something that you basically are going to have to be developing ways of studying that keep your brain interacting with the material. And I know that can be a little overwhelming. We're going to talk about that in tip 3. But one of the things, well, let's just jump into tip 3. Okay, tip 3. So what can help you? Because I know that's like super overwhelming. When you have like 17 chapters to study before your next nursing exam and you have an ADHD brain, and you're like, what am I going to do to cover this? And then you hyper focus on cleaning your house instead. Okay. You have a clean house and that's nice, but you need to study for your test. And I think a lot of times we also tend to do this. It's easy to avoid and procrastinate for anybody when you're feeling overwhelmed. So we want to reduce the overwhelm. And that's what step 3 is about. So this is one of the many reasons why I recommend studying with the Silver Bullet study system. I think it works really fantastic when you have ADHD too. So when people ask me all the time on my TikTok and things, they're like, okay, Silver Bullet study system sounds great, but does it work for me when I have ADHD? Yes, it does. My advice is the same to you. You still need a good way, a solid way to study in nursing school, and it'll do it for you. One of the benefits of it is it teaches you to study step by step. So it breaks down the overwhelm because each step goes with a question. So you are basically, instead of just like looking at the big pile of spaghetti and trying to find one noodle, you're like, I just have to answer this question. And then that can be a little bit easier. And so like the first question for step 1 of the Silver Bullet study system is, what do I need to know about normal before I can begin to study whatever topic it is that you're studying, okay? If you want to learn more about the Silver Bullet study system, I give you all of my trainings, all of my resources, all of my example Silver Bullet study system outlines in my group tutoring membership, okay? If you don't like, I also have a self-study course that's like no live support, but you can just get the trainings. If you don't like that, if you want me to just like, Nicole, can you just teach me? Yes, I can. If you want me to just teach you the Silver Bullet study system, you can just sign up. I can teach it to you in one single one-on-one tutoring session, and you can sign up for one of those too. But I will tell you, if you do it as a one-on-one tutoring session, you probably are also going to want to get the group tutoring membership, at least for a month or two, because that's the best way for like, I can teach it to you, but you have to practice. You have to practice. And as you're practicing, you're going to realize, oh, I understood it when Nicole taught it to me, but now that I'm out doing it on my own, I feel a little unsure. And in the group tutoring membership, you can post in the forum, the members forum, you can post what your study notes are, like your Silver Bullet study system notes, as you're trying to do it for yourself. And I will do a video review of it and let you know, like, this is where you did it perfect. This is where we can tighten the connections. This is some information you might want to add into it, and give you that targeted feedback so you can feel totally 100% comfortable that you are doing the process correctly, that you are studying like a nurse, so that then you can be confident that you're learning to think like a nurse too. So, yes. But specifically, as this relates to nursing students with ADHD, the Silver Bullet study system is nice because even if you get distracted or if you're taking frequent breaks, either way, on purpose or not on purpose, because the Silver Bullet study system is so systematized, it's so methodical, 1, 2, 3, 4, without being boring, okay? It's because it's interactive. It's more like a framework, so you can make it, anybody can make it work for their brain. I designed it that way specifically. So you can use whatever your favorite resources are. If, reading textbooks, if looking at textbooks makes you want to claw your eyes out, that's okay. You can like use YouTube videos and still as your main resource and still successfully do your Silver Bullet study system outlines and study that way. So it really works for however you prefer to learn, no matter what your learning style, ADHD or not, okay? And anytime you might get distracted, lose focus, take a break, it's okay, because then you'll come back and you know exactly where you left off. So you're like, oh, I got distracted after step 2A. Okay, that just means I need to start on 2B now. And I know exactly what to do at step 2B because it says right here on the sample outline. Okay. And when we do that, it's less overwhelming. It really cuts down on the overwhelm because it helps you pre-decide like what you need to study next. As compared to how you're probably studying now, which again is like, there's 17 chapters. Where do I start? And then you just like pick a chapter and start reading the textbook or looking through your PowerPoint notes or highlighting or copying and pasting. And those are all passive learning strategies. It's really hard to stay focused, really hard to remember and retain and to really understand it. And it's also, if you get distracted, you come back and you still got 17 chapters to read. And you're not really sure where to start from where you left off. But it's very clear cut. When you're finished studying a topic with the Silver Bullet study system, you know that you are finished studying it. It's not like that constant lingering fear that, oh my gosh, what if I need to know about that caption on page 384? Maybe I should go back and read for another hour. Nope, just go to bed on time. You already did all 4 steps of the Silver Bullet study system on that topic. You got a review from Nicole in the group tutoring session. It's good. You're good. You can go to bed. Okay. Now, my last, possibly most important tip for ADHD when you are in nursing school is to celebrate your successes. Celebrate your successes. Now, if you guys have ever seen any of the Holderness family videos, like they're I guess they started out as a vlogging about their life or whatever. They're on YouTube and TikTok and all the social media platforms. I love watching them. They're so fun and they're so funny. And the father, Penn Holderness, he has ADHD. He actually recently came out with a book, which if I remembered the name of it, I would tell you right now, but I can't. But I saw he did a TikTok video promoting it the other day that I absolutely loved because he's also a musician. So they do a lot of like spoof songs. And he sang a song pretty much about how amazing the ADHD brain is and how creative it can be and things like that. He also did another video promoting the book with his son, who also has ADHD, where they said they were home alone for the weekend. And so they were trying to manage the house by celebrating, because they said like you get bored doing like the routine tasks all the time, right? So they're like, so every time they do something small around the house, like empty the dishwasher or something like that. They would celebrate like they got the winning touchdown in a football game. Okay. So, and that's great. And that's awesome. Honestly, everybody should do that. That's good advice for everybody. I think we should all give ourselves a pat on the back when we empty the dishwasher or fold the laundry, or even don't fold the laundry and just dump it unfolded in your drawer. Like, really, who cares? Most stuff is wrinkle free nowadays anyway. But maybe hang up your scrubs. Maybe hang up your scrubs because your clinical instructor might give you the side eye if those are too wrinkly. But celebrating your successes is key. And so when you do this, then it basically gives your brain the little dopamine hit that, hey, I just did something good for myself and it was worth celebrating. And then that kind of encourages you to keep doing the next thing. And it gives you that positive feedback loop to be doing the types of study things that are going to help you. So if you're doing the Silver Bullet study system, you can celebrate after each step. You can celebrate after you get a completed Silver Bullet study system written, in addition to celebrating when you get a passing score on your tests. I do this in my group tutoring membership with my students. I encourage them all to post in the success forum. We have a separate success forum that is dedicated. It's dedicated to successes. And I try to encourage, it's like an uphill battle, but I try to encourage everybody to remember successes in nursing school are not always about grades. Okay. That's the obvious one that most people, will think, oh yeah, I got an A on my test, or I got a B on my test, or I got the barely passing score on my test, but I'm happy about it because that means I'm going on to the next test and I didn't fail. But there's so many opportunities for non-grade successes in nursing school. And I really want you to focus on those, especially again, when you have ADHD, because even if it's something as like, I got to clinicals on time because I planned to get there an hour ahead. So I got there on time, or whatever it is for you. Like, everybody's a little bit different, right? And the fact that you have a good clinical day. Maybe you did a skill that you've never done before. Maybe you answered a question in class. Maybe you just had a light bulb moment when you understanding something about heart failure, which I'm doing a podcast. I don't know when I record these podcast episodes each month kind of all together, and then I edit them and put them out. So I am planning to do a podcast episode on the symptoms of heart failure. And I love teaching on heart failure because you will have, when you listen to that episode, you will have an aha moment. So you can check if it has not come out already. It's coming out in May. If it has not come out already, it will be coming out soon, that episode. And I'm going to show you exactly how I give this aha moment to nursing students using the Silver Bullet study system, because it doesn't have to be me giving you the aha moment. You can do it for yourself when you learn to study this way, even if you have ADHD, okay? Especially if you have ADHD, because again, you have such creative brains that you can tend to see connections in new ways that people with, let's just call it traditional brains, may not be able to see in the same way. So those are just a few suggestions for studying with ADHD, for tackling nursing school with ADHD. I tried to keep them kind of specific to nursing school. Obviously, all of the tips that you can find out there online for ADHD in general are great for nursing school, like how to be organized, how to create routines, how to clean your house, whatever. Those are all good too. But these are just a few that are very specific to nursing school that I wanted to share with you today. And again, if you want some more, then you can join my group tutoring membership and watch the entire 1 hour video. It's included for free in the resource library that gets given to all of my group tutoring members. Even if you just want to join for a month, and then you can cancel, because you can cancel anytime. I don't require any long-term contracts or anything like that, because I want you to be supported for what you need. And eventually I want to tutor myself out of a job because you have learned how to think like a nurse using the Silver Bullet study system. So come join our community. We're positive, we're supportive, and we like to celebrate. So if you'd like to learn a little bit more about the Silver Bullet study system before you join, then you can get a free 10-minute video about the Silver Bullet study system by going to yournursingtutor.com yournursingtutor.com/SBSS. That's yournursingtutor.com/SBSS. And when you go there, you just have to put in your email address, and then I will email you a 10-minute video that goes through all 4 steps of the Silver Bullet study system and explains to you what they are and why they work. If you're just ready to jump in, you can always go to my website at yournursingtutor.com, and you can join my group tutoring membership today. Get a complete course on the Silver Bullet study system, more than just a 10-minute video, plus lots of examples, plus be able to ask me questions about the Silver Bullet study system, how it applies to your specific class and fundamentals or med-surg or psych nursing or whatever it is that you're taking. And you can ask me those in our weekly group tutoring sessions. You can ask me that by posting in the forums. That's for my members. And you can even, as I said, post your Silver Bullet study system notes that you learn how to create so that you can get feedback from me and make sure that you're doing it correctly so that you can get the goal, get the results that you want in nursing school, which is going to be better grades, right? So yeah. Now, one last thing before I go for today. If you have a moment and if you got any value from today's podcast, I would really appreciate it if you could go to Apple Podcasts and look up the Navigating Nursing School with Your Nursing Tutor podcast and give me a 5-star rating and review. It really helps other nursing students and nursing faculty to find this podcast when it has the good reviews. And if you leave me a written review, I might even feature you on a future episode of the podcast. So hope to read your comments there. And even if you don't have time to write something out, just come and give me a 5-star review. It's definitely every little bit helps. So until next time, good luck on your nursing school journey.